Hello, my name is Sydney Train, and I'm the Focused Childcare Network Coordinator here at the Early Learning Division of the Department of Education. You know all about the new guidelines for operating childcare during COVID times. We issued the guidelines on August 14th after extensive input from providers, parents, public health experts, and more. It reflected the best information we had and the Oregon experience with COVID at that time. Since then, we've been communicating with providers and learned what is and is not working. We've worked with public health experts and benefited from more research into COVID-19. Based on all that information, we've updated the guidelines with an amendment and now have created the Guidelines version 1.1. These are small changes, most of which will make things easier for providers. You've probably watched many of the videos we posted, one for each of the 14 sections of the guidelines. Because there are changes to almost all the sections, we've pulled down those initial videos. This one video will cover the changes to all the sections of the guidelines. Please do read the amendment for all the specifics. There are some details we won't cover in this video. Section 1, drop-off and pickup. Winter weather is here, and we've heard from you about the challenge of doing drop-off and pickup outside. So we are allowing you the option to conduct drop-off and pickup inside the facility. Here are the conditions that need to exist. Your location is experiencing inclement weather. Hail, lightning, strong winds, sleet, snow, freezing rain or ice, or it is at a freezing temperature of 32 degrees or lower. The adult must wear a face covering and everyone stay 6 feet apart. You must not use a fan in the entry. They can spread the virus. Section 2, daily health check. The Oregon Health Authority has suggested changes based on the latest science and research on COVID that improves on the check for COVID symptoms and should be more efficient for providers. You are no longer required to take a temperature of people entering your childcare. If you do not, you must ask whether or not the child has a fever. Ask the adult or the child if they're old enough to answer. If they don't know, take their temperature. Also, you can continue to take temperatures if you would like. The questions about exposure to a positive or presumptive COVID case has changed a bit. The questions are now more precise about when that exposure happened and narrows who might need to quarantine. See the amendment or the updated exclusion chart for the updated questions. The third question, involving symptoms, now includes, quote, a new loss of taste or smell, end quote. The exclusion summary chart has also been updated to include the symptom of a new loss of taste or smell. The question involving the second set of symptoms, headache, vomiting, and others, has been removed and has been replaced with an updated symptom list and a reminder. OHA has clarified that this list of symptoms is not about COVID, but is focused on all the other childhood illnesses you always need to be checking for. So this now encourages you to remember these symptoms in addition to your focus on COVID. For individuals who have been exposed to COVID-19, the quarantine period has been changed to 10 days. While quarantining for at least 10 days is recommended, the quarantine could be shortened to 7 days when certain conditions are met. Review the amended health and safety guidelines for more specific information. Section 5, stable groups. In light of the governor's announcement about county risk levels, the references to counties at baseline have been removed. Group sizes are not tied to county metrics. Childcare programs statewide will continue to adhere to ELD's health and safety guidelines for childcare and early education operating in COVID-19. OCC has been seeing programs expand their use of volunteers, practicum students, and other additional staff, and not adhering to the limit on adults in stable groups. So the amendment clarifies that only one additional adult beyond what you need to maintain ratio is allowed in a stable group at one time, with the exception of specialized services, and any extra staff or volunteers must maintain as part of a stable group. Specialized services or tutors are services to children such as those associated with early intervention or early childhood special education, or individualized education plans, IEPs. Also in Section 5, we address the team size in registered family care. Soon after we issued the guidelines, we heard from registered family providers about the restriction on team size being too low. After consulting with public health, OCC expanded the team size allowed in registered family to 16. That has been the rule for some time now, and now we've added it to the official document. Section 6, Personal Protective Equipment, or PPE. There is a significant change in this section. The amendment removes the requirement to use a clean outer layer, whether during health checks, for floaters, or when feeding infants. The Oregon Health Authority has determined that this is no longer necessary. The section also updates recommendations on plastic face shields to match the recent statewide face covering guidance from OHA. Plastic face shields are no longer recommended except for special cases like a person who is hard of hearing. This is due to the growing evidence that the face shields do not protect as well as cloth coverings or face masks. However, the amendment does not prohibit the use of plastic face shields. Section 11, Responding to possible and confirmed cases of COVID-19. This section has similar changes to those in the daily health check section. Symptoms for adults and children now require exclusion if their illness includes a new loss of taste or smell. The exclusion summary chart has also been updated to include the symptom of a new loss of taste or smell. 10-day quarantine is required for a person who is exposed to a positive or presumptive case of COVID-19, but it now specifies the exposure is while that COVID case was in the infectious period. The 10-day quarantine could be shortened to 7 days if certain conditions are met. Review the amended health and safety guidelines for more specific information. For exposure to a positive confirmed COVID case, that person is considered infectious for the time from 2 days before until 10 days after they tested positive. For exposure to a presumptive COVID case, that person is considered infectious for the time from 2 days before until 10 days after they developed symptoms. Note that the updated exclusion part chart puts in the reminder that the normal, non-COVID childhood illnesses are still out there, and you need to be thinking about those as well as COVID. Section 12, Transportation. There are two main changes in this section. One is only for home-based providers. Most home-based providers transport children in passenger vehicles, not buses, making it nearly impossible to keep 3 feet distance between people in the vehicle. Also, home-based providers care for 1 or maybe 2 stable groups. Therefore, the amended guidelines change the 3 feet distancing to a strong recommendation rather than a requirement. For facilities that operate their own large vehicle like a bus, and for facilities that receive children from that kind of transportation, there are important changes making the child care guidelines and school guidance more consistent. It is no longer required that an adult drop off the child at the bus stop and answer the health questions. That role can be filled by an older sibling, by the child themselves if they're old enough, or the question can be answered when the child arrives at care. This would require a system for reaching the person who can answer those questions, such as by phone call, electronic form, or text. We have updated the FAQ section on our website and will continue to update that with your questions and our answers. If you don't find an answer there, please email your question to providercontact@state.or.us. Again, providercontact@state.or.us. Or contact your licensing specialist. You might be wondering what resources or supports the Early Learning Division and Office of Child Care will be providing. We have already updated all the technical assistance documents that need to be changed. This includes the exclusion chart. If you have any ideas for other resources, please send those ideas to the provider email address and we'll consider them. Thanks for watching, and thank you for the amazing care and education you provide to Oregon's children.